Okay, so ChadVasc score, it's broken up into the different parts. It's like a mnemonic ChadVasc. So 1 point for C, which is CHF, and then we have hypertension, 1 point age 65 to 74. D is for diabetes, and then we have female sex, vascular disease, and 2 points for age greater than 75 or equal to 75, history of stroke. Okay, and a score of 0 indicates that no anticoagulation is indicated. A score of 1 or 2 in women is no anticoagulation versus oral anticoagulation based on clinical judgment. So that's kind of the gray area where providers should decide whether anticoagulation is indicated or not, and you can also implement the HASBLED score in those cases. And a score of greater than or equal to 2 or greater than or equal to 3 in woman, usually indication for anticoagulation. And next up we have the HASBLED score. This is risk stratification of bleeding with oral anticoagulation. If patient is hypertension, if the systolic of greater than 160, abnormal renal function with a creatinine clearance of less than 50, or history of liver disease, cirrhosis, that can increase bleeding risk, of course. NSAID use, history of alcohol greater than 8 drinks per week, or other drug use. And each one of these is a score, 1 point. If there is a score of greater than or equal to 3, it suggests, caution and regular follow-up for these patients that are on anticoagulation, and potentially, weighing the risks and benefit and having that discussion with the patient whether to be on anticoagulation or not. Okay, so next talk, we're kind of running out of time here. Anticoagulation. We'll be talking about the different types, DOACs versus warfarin, and the studies that have been done comparing the two, as well as dosing with renal impairment, and also bridging anticoagulation.